Pathways to Housing DC was started to end homelessness for people living on the street, jails and psychiatric hospitals of DC with serious mental illness, psychiatric disabilities.
And Pathways came into my life, kind of held my hand, took me to my appointments, got things done, set doctor's appointments, filled out paperwork for me until I can able to do it by myself. They showed me the things to do.
We have treatment teams working with people in their apartments. They consist of psychiatrist, nurse, peer specialists, employment, housing specialists, social workers, all wrapping services around each person.
And AC delivery and
electronic health records in today's healthcare delivery is critical.
When we decided to implement the electronic health record, we knew we wanted to be able to give the best patient care possible. We wanted to have the best tools for our staff so that they could give the best care.
We now equip our staff with varying pieces of technology to help their jobs. Some use tablets, some use smartphones, some are using laptops with wireless, and so they can, with the person in their home, sit down and pull up their treatment plan, for example, or pull up their medication and review with them. How is it working for you? What can be helpful? And they can pull up the records from the other providers in our teams who are seeing the person, one of which is Unity Healthcare. The electronic medical record has really helped us move forward because everyone has access at any time to the treatment information.
We schedule your appointment.
That Pathways, and we can see the case managers as well as we see the doctors, and we don't have to waste our time going over, the other side of town. The doctors is familiar with the case managers. The case managers are familiar with the doctors and everything, and they have access to our records, and it's very good here.
With the click of a button and online, the provider here, our nurse practitioner, when they see someone, can pull up the records from all of those other sites, so the person doesn't have to repeat their history, repeat what treatment they had, and they can really have access firsthand to all the treatments.
Unity, they know me. They know what's wrong with me, my health issues, and I feel more comfortable with somebody knowing that's wrong with my health issues than to go to somebody that doesn't.
Within the electronic medical records, there are data elements in place that allow us to assess for different behavioral issues such as risky alcohol intake and substance abuse use, tobacco use, and those types of things. And we can take that information and kind of get an idea of where the patient is and how we can meet the patient needs and communicating with the appropriate mental health provider within the organization.
So the electronic medical records pulls it together, and it allows for the medical team to be more integrated in the delivery of care. If I'm a doctor, I might be seeing a patient, but the most important person in that patient might be the outreach worker who's going out to the patient's house and actually visiting with her and then reporting back.
So it's a more comprehensive kind of approach to the treatment. And it really has saved lives here, actually. We've seen that firsthand.
If it wasn't for Pathways coming in my life, I probably wouldn't be living Unity, and it saves me a lot of time. And I know they know what's going on, so I thank God for Unity and everything.